Welcome, Internet. Today we're going to be talking about why it's so important for psychologists and psychotherapists to work in institutions. So, before we begin, I need to say that this perspective is mine. I'm not asking you to share it and I'm not asking you to agree. I'm just laying out what I think. Also, and this is very important, I believe that institutional work does not negate private practice work because you can do both at the same time. It's not one or the other, not necessarily. And thirdly, the important reason why I wanted to talk about it is that at least in the current generations and generations to come, a lot of therapists are disinterested in working in institutions, which sometimes have very good reason, right? It's not, how can I say, oh damn, those kids, they don't know what they're talking about. No, sometimes it is genuine, it's out of genuine concern that the public sector is worsening, that the working conditions are less good, patients don't get the care they need or deserve, and so on and so forth. So there are very valid criticisms, which I've talked about in a previous video. But my aim here today in this video is to present you why it's still so important and why, if you feel like it, you should definitely test it to work in an institution and try and see if that works out for you, if you're of course interested. So here today I'm going to talk about those reasons. The first reason, and perhaps one of the most essential, is that in institutions you'll be able to provide therapy or care for people that would not be able to afford a private practice or who need more care. For example, a very concrete example is people, for example, with schizophrenia are relatively rarely encountered in a private practice, as they don't necessarily have the financial stability to be able to pay a therapist every week or every other week for services. Therefore, when you're in an institution, you're gonna meet people with more severe disorders, but also you're gonna have the ability to help them also trying to navigate through those severe disorders. Of course, I talked about schizophrenia because that's what I know best, but we can also talk about dementia, intellectual disability, and so on and so forth. So it's a whole range of people that you have in institutions that you don't necessarily have in a private practice. Also, an important point is that in an institution, you're not necessarily paid on how many people you see, but just on the work you do. So for example, you can take sometimes a bit more time in institutions when, for example, you're not paid per patient, but just you paid on the total of the day. So therefore you can sometimes take a bit more time than you would normally. I would also say that in institutions, one of the main attractions I feel, or something that I feel is one of the best, is that you can work with other people, what is called a pluridisciplinary team, in which basically there's other professions. For example, sometimes there's psychiatrists, sometimes depending on the institution, they can be nurses, they can be psychometricians, they can be physiotherapists, speech therapists, and so on and so forth. So when you have those other professions, there's an enrichment because you get to talk about other fields. You might get to talk about how they see the patient or what they work on with the patient. You might get to even share psychological knowledge with them, and it might be a wonderful exchange in which people just grow as people and as professionals. So it can be, if it goes down right, a wonderful exchange between professions. Also, another important point is that when you need help, there's always someone in the institution to give that help. For example, if a patient shows signs of violence or of severe depression, suicidality, or acting out, you have other people that can come and help you. You can open the door, call for help. This is important, especially because in our day and age, in our culture, we're more and more isolated and fragmented. But the institution has a global effect, has a containing effect for everyone, both for patients and for professionals. Also, there's a very important thing is that when you're working in an institution, that feeling of never being alone, working in a team, is a nice feeling to have because basically There's a phenomenon of trust. You get to trust your colleagues. You get to kind of live your experiences with them. Sometimes also they can give you a part of their perspective that you might have missed, because the way we psychotherapists and psychologists take care of patients is very individual focused. Therefore, we tend to basically focus on the individual, but we don't necessarily know what's happening outside, and they can bring back that perspective. For example, a nurse that does a group with a patient might say, "Whoa, well, with me, he's very aggressive. He just doesn't want to talk," and basically that knowledge allows you to navigate better and to try and help the patient in a more global way. And sometimes you can even be honest. You can say, "Can I say to W that you've told me that?" And the professional might say yes or no, depending on if they feel that might hurt the relationship or not. And sometimes you can say to the patient, "Well, my colleague told me this, and that was her perspective. Do you agree with it?" And sometimes it allows the patient to reunite from a splitting, i.e., what's happening is that the patient might be breaking off parts of themselves and parts of their representations of the world into two different professionals. The institution allows us to see those two parts, whereas in practice we would only have one part, and the other one would be out of sight, out of scope, and so we would not necessarily be aware of it. Also, a very important fact is that sometimes certain patients, like I'm thinking about psychosis here, can have what is called blanks of thoughts, like they don't necessarily sync up ideas, or they're not necessarily too communicative if they're withdrawn within themselves. This withdrawal can be very hard to navigate if you're not aware of a global context. For example, if you don't know about the family, if you don't know about the environment, the immediate interaction, and so on and so forth. But when you have colleagues, and when the colleagues, for example, mention sins, these sins that they mention or they talk about can be then heard by the therapist and then used in the session to try and help the patient. So it's often a very interesting parallels of connections of basically a form of network in which the therapist and the psychologist is not the main center of the stage, or is not the main professional, but one of the professionals, meaning that the whole load of the psychotherapy is not just the psychologist, it's a bit of everyone. In institutional psychotherapy, which is the French version of anti-psychiatry, even though they would dislike me saying it like that, but it's for you to get the idea. There's this fundamental core belief that everyone plays a role, a very fundamental role in the healing of the patient, be it the psychologist, the psychiatrist, the janitor, the nurse, the educator, and so on and so forth. And we're all involved together. And this constellation of professionals allows for the patient to have forms of regression with certain professionals and forms of maturation with others. It allows the patient to be, in a way, contained in the most positive light, i.e., taken care of and about. And this is so very fundamental and important. And that's a type of work you won't necessarily have in a private practice. In a private practice, you'll be basically not on your own necessarily, but you'll be much more focused on the individual rather than the collective. And I think that's fine, that's great, but I think some people, mainly people with more severe psychopathologies, like schizophrenia, like dementia, like severe bipolar, and so on and so forth, will need the benevolence and the containment effect of an institution. And here, when I say containment, I have to be very clear. I don't mean physical containment, like putting them in a pad cell or isolating them. I really mean in that psychological sense of someone is always there to talk to, someone is always there to be able to do activities with them, or that they're all there for a certain level of work. Regardless of the exact precise nature, these containments given by all the bits of the institutions, all the chains, because I see it a bit like a massive chain of people there to basically help. means that the patient is going to grow better, and not just thanks to one individual, but a whole plethora of them. It's really when institutions work well and they're basically a force for good because of many reasons, because systemically it's not been wrecked, because the people on top are listening to the people that are on the field and not because they're imposing stuff. I mean, there's a lot of variables of what makes an institution a good institution, right? But when it works, it's so very good, as it basically allows the patient to re-experience the purest form of care. Because as psychologists, we meet our patients once a week, twice a week, and it's not enough for certain patients to fully let go of their defenses, whereas an institution is 5, 6, 7 days a week. So there's much more time, and you don't stay there an hour, right? You often stay there the whole day. So there's much more leeway for a form of appeasement of the defenses, that in a way they can fully trust the professionals. And even if they don't trust professionals, often there's a split, like they might trust one and not the other for X or Y reason. But the idea is that there's many people, so everything that needs to be experienced can be experienced within the institution. That doesn't mean that there is not attacks or moments where it's complicated, because there always are. But I would say that in an institution, because of the multiplicity of professionals, these moments are not as hard felt and as hard lived as they would be if the clinician was completely isolated and basically having to deal with the patient on their own, so to speak. So therefore it has a very almost reassuring for the practitioner to be in an institution. Also, I must say that purely on a technical level, institutions provide certain benefits that private practices don't. For example, here in France, it provides you with paid vacation, paid leave. It provides you with a certain form of social security as well, added to the normal one. There's some form of what we call mutuelle, i.e. Healthcare benefits. So there's a whole plethora of things that are very positive, even just as a technical benefit. But it's not the main reason. The main reason is that there's people that you'll meet there that you'll never meet in a private practice. And there's ways of helping that are more collective. And I think that's a very positive trait. And that enrichment, as I was saying, between professionals, between perspective, ideas, views, just thoughts that are different, and because the fields in which every practitioner works in is very different. All of that is so enriching on a personal level, like you get so much out of it. And sometimes you can also help others, other professionals, and guide them, try and enrich them with your perspective, or try and say, oh, well, I think it works like that. The whole point of an institution is the communication, really the exchanges you can have, and how it broadens your horizon as a therapist or a clinician. When I was training in university, our teachers used to tell us, never start with a private practice, always start with an institution, because that's where you get all the basics and fundamentals. So even though I'm not 100% in agreement with that, because I think everyone should do what's best for them or what's best suited for them, especially given that a lot of institutions can be suffering themselves and in having many issues. But I do think that an institution that works well and functions well, and in which the clinician has a space and can work with the patients and with the teams, is so very fulfilling and so very enriching. And unfortunately, in our day and age, where we going towards a psychotherapy that's much more independent from institutions, a lot is lost, because these spaces are very important, because they allow for another level of care towards the patient, but they also allow us clinicians to basically be in a more social environment and help us acquire the basics. Because if you don't know something because you're starting out, someone else might know them. Or even if you're a seasoned clinician, some people can have different ideas that are as good as ours. I mean, it's not because we've done 7-8 years of studying that we have all the knowledge in the world. We don't. And sometimes another perspective from another professional with other tools can help tremendously. And that's so wonderful. And I think that that's something in private practice that's, even though we have intervision, supervision, and so on and so forth, it's not the same, because in institutions, you're together with this idea that whoever comes into the institution, you have to all collectively try and find a way for it to work. At least you have to try for the patient and for your sake, collectively. Whereas in a private practice, you have to deal with things on your own. You have to, even if you have doubts, you can refer to someone, or you can send the patient to a higher level of care, as is often said, but it's not the same. Like, I mean, here in the institutions, it's this idea that basically we have to deal with whatever comes. And I find that very warm in terms of welcoming. You welcome people as they are, and you try to work out with them what is happening on a groupal level. Whereas in private practice, you do the same, but it's always on an individual level. That's my gist of it, and why it's so important to still work, and we still have many things to bring in institutions, because often other professionals can be sometimes a little lost and not know what to do. It's true that having a psychologist or a psychotherapist in the institution is often very assuring. For example, if a patient is feeling really down or really depressed, you can send them to the therapist or the psychologist for examination or for a consultation. There is always this element that we support each other. For example, when I don't know what to do, I send the patient to one of my colleagues that's more specialized in certain areas than I am. Or inversely, those colleagues, when they feel overwhelmed, will send the patient to me. And so it's this whole dialect that basically it's a bit like an orchestra. All parts of the orchestra have a role and are important. It's together that you hear the symphony. And it's fundamentally that. The working institution is a symphony. And of course, not everyone wants to be part of it, or not every orchestra works great. But those that do are wonderful. And that's why I wanted to share with you, because often, and too often these days, people want to just push out the institutions as an option. But I don't think that that's quite a good way of seeing it. If it's something you dislike, if everything I've said made you cringe, it's that institutions aren't for you, but for some people they are, and unfortunately those people are missing out because they have an archaic version of institutions where people were forced, repressed, hurt, and all of that did exist and still does in certain ones. But nowadays, at least in France, it's no longer the case. Institutions try to do their best, and the best, even though there is always this tendency of regressing to more archaic and more inhuman nature, most professionals don't want that. Most professionals want to keep the humanistic nature of our institutions. Therefore, they're often places where some healing can happen, and when people really do try and do their best. There are other issues, of course, like burnout, mismanagement, and so on and so forth. I'm not trying to say this is perfect and this is the greatest part of humanity, but professionals often try their best. They often make a very honest and profound tentative to try and help the patient. And often collectively, that's what happens. Everyone tries to help it in their way, and that's what heals, is the help and the care that professionals put in the institutions. And basically, I would not want anyone that loves that idea to miss it, and that's why I wanted to talk about it today. So I hope I wasn't too, too idealistic. And if you have any questions, any comments, anything you would like me to talk about, or if you feel that you have any questions in regards to institutions, at least French ones, feel free to put them down in the comments. It's pretty much it for the video, so I'll see you in the next one. Bye.